Our study looked at patients across 11 academic U.S. centers. We had 99 patients with relapsed and refractory follicular lymphoma treated with bispecific antibodies in the standard of care setting. And our goal is to see if they were as efficacious and safe as they seem to be in the clinical trials in a real-world population. And the answer really seems to be yes. For context, our population included older patients. The median age was 68 years. Over 60% of patients were 65 years or older, and 12% were 80 years or older. Half had progression of disease within the first 24 months of initial therapy. About half had high-risk FLIPI score. Most patients had advanced stage disease. So it was a very high-risk, heavily pretreated group as well. The median prior line of therapy was 3, but it went up to 14 lines of therapy. And despite all of this, we still had really impressive response rates. There was an overall response rate of 87%, a complete response rate of 72%, a 12-month PFS of 72%, and then a 12-month OS of 94%. So actually, the response rates were even better than what the trials had shown, and the survival times were similar. And for context on the survival times, we had about 17-month median follow-up. As far as safety goes, things were also quite impressive. Only about a third of patients had CRS, and there were no CRS events greater than grade 2, so no patients needed to be in the ICU. There were no deaths due to CRS. Only 3% of patients had ICANS, and none greater than grade 1. And then about a third of patients had infections, no deaths due to infections. So to conclude all of that, I think we've shown, or at least added to evidence, that bispecific antibodies really are safe and effective in the real-world setting in patients with relapsed follicular lymphoma.